Hello, Dr. Mercy here with All Mercy Psychiatry and Integrative Care. How are you doing? Let us conclude our A word in our A to Z series of common mental illness disorders. Last week we talked about anxiety. Let us finish today so that next week we can find a B word. We combated anxiety with affirmation and with action last week. This week, let us talk about how we can treat anxiety. After you have affirmed yourself, positive self affirmation, tell yourself you're better than anxiety, take some actions towards getting help. In that process, try to understand what is anxiety, especially what is anxiety to you. How does it make you feel? Because your anxiety may be different from my anxiety. Everyone has experienced anxiety at one time, but the experience may have been different from everybody, especially depending on what triggered or what caused that anxiety. So the feelings, the physical sensations, the emotional sensations may be different. So think about how anxiety makes you feel. What are the impacts? How does it stop you from doing something, especially the negative feelings? How does it hinder you from doing something? Some people get so anxious preparing for a job interview that they end up not even going to the interview. And who knows what could have happened had they had the courage or had they been less anxious enough to go to that interview. So think about the different ways anxiety has impacted you. Think about the cause. Think about what triggers it. Think about how it makes you feel. Understand who you are with anxiety. That way you can be able to combat it better. Think about your thoughts. What are your thoughts doing to you? Think about how sometimes you worry about things that are not in your control. Think about sometimes how irrational you can be. Change those into reality. Sometimes you can just be uncertain about so many things. We all have uncertainties. Thinking to the point of worrying excessively about them is just destructive to your mental health. Sometimes you just have to live healthy lifestyles, good coping mechanism. Replace those worrying thoughts or those anxious moments with healthy coping skills like exercising, eating healthy, enough sleep, well hydrated, stop caffeinated beverages, stop alcohol, stop smoking. All these have been known to reduce stress levels tremendously. So all these healthy coping skills can also help with your anxiety. Think about relaxation techniques and distractive techniques like deep breathing. It always helps. Deep breathing, it always helps. Meditation, it makes you feel one whole with yourself. It brings you to your inner self. It brings you to the core, to the warmth of your heart. And you try to breathe out the anxiety. And sometimes while doing this, there's a 5-to-1 rule where you can think about the 5 things that you can see around you. You can acknowledge some 4 things that you can touch. You can also acknowledge some 3 things that you can hear, some 2 things that you can smell, then some 1 thing that you can taste. When you do this often, 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, 1 thing that you can taste. Do it very often. You have trained your mind, and you are training your subconscious mind to be distracted and to refocus, re-energize. So again, I will say listen to your professionals. If they recommend therapy, please take it seriously. If they recommend medication, please follow their advice. Sometimes therapy alone, like mindfulness, talk therapy, can help. But if it doesn't help, please be open to medication. And taking medication does not mean that you will be on medication forever. Many people believe that when you take medication for mental health, it means that you'll be on medication forever. No, that is not true. And even when you take medication plus therapy, those combined treatment types have been known to work the best. Also, there are short-term medications, goals, or treatment options, and there are long-term treatment options, depending on how you're responding to treatment, or depending on how severe the anxiety is. Please do not be defined by anxiety. Your name is not anxiety. Your name is who you say your name is. Anxiety is just a symptom of the moment. It is a sensation of the moment. Don't make it a routine in your life. Move forward, move past that. And again, we are here to help. Always, we are here to help. I hope this has helped. Next week, we'll find a common mental health disorder word, and we dwell on that. Thank you so much. Again, you can always call us 682-376-6776, or you can email us at mercy@allmercypic.com. Thank you so much. It's always a pleasure being with you guys. Bye-bye for now.